According to Health Minister Zulkifli Ahmad, more than 50,000 new cancer cases are detected every year. Alarmingly, most are only identified when the disease has already reached stage 3 or 4. This is why regular health screenings play a crucial role. They can make all the difference in detecting cancer early. With October being Breast Cancer Awareness Month, it's the perfect time to talk about a powerful screening tool, the mammogram. As part of its mission to be a center of excellence in diagnostic imaging, Institut Jantung Negara offers a wide range of services from heart scans to mammograms. FMT sits down with Dr Sulaiman Tamanang, Senior Consultant Radiologist at IJN, to learn how mammograms can help detect breast cancer early and what women can expect during a screening.
Mammogram is the safest, the simplest, and the easiest, and is available everywhere to do the examination to detect if there's any problem with the breast. Of course, there are other modalities that can examine the breast, like MRI, all those things, but the MRI is more expensive. It's not easily available. Not all centers has got MRI doing breast examination. Mammogram is the simplest, is easily available, and is cheap. Mammogram use X-rays that produce images. Why mammogram is important? Because early cancers normally present either with microcalcification, tiny knot of calcium, or just sometimes just some structural distortion, very small structural distortion, and this can only be seen with mammogram. Sometimes we can use ultrasound as well to look for all this growth in the breast, but as far as microcalcification, actually the only modalities that can easily pick up is actually mammography.
Sulaiman advises women to have their first mammogram between the ages of 35 and 40. From age 40 onwards, yearly screenings are recommended. He also urges women in their 40s to do a self-examination of their breasts regularly and not wait a full year for their next mammogram if they noticed anything unusual. After turning 50, mammograms can be done every 1 to 2 years. But what's the reason behind this recommended frequency?
In Malaysia, most of the patient is actually premenopausal, 40 to 50 years. But it's in the US, the incidence of breast cancer is more postmenopausal, after 50, after menopause.
According to Sulaiman, statistics show that 1 in 19 women in Malaysia will be diagnosed with breast cancer in their lifetime. Each year, the number of cases rises about 2% to 5%. The disease is most common among the Chinese, followed by Indians and Malays.
The detection of early breast cancer is actually very important in terms of outcome or prognosis. Okay, so the rate of survival in early detection or stage 1 breast cancer is actually more than 98%. For those detected in late stage, stage 3, stage 4, I think the survival rate will be less than 50%. So again, if we can detect it early, so usually the patient doesn't have to do removal the whole breast or mastectomy. They can only do the lumpectomy. That means they remove the abnormal area and then that's it. So they preserve the breast. So nowadays they try to do that as far as possible, because I think nobody wants to have only one breast, so they feel unstable. No? So I think they try as far as possible nowadays. The breast surgeon will do a lumpectomy rather than mastectomy. Early detection will save costs, a lot of costs, because in the later stage of breast cancer, they have to do a lot of things. The chemotherapy, radiotherapy, and this chemo and radio actually are not cheap. They are very expensive.
At IJN, a mammogram screening only takes about 30 minutes and you'll have your results in roughly 2 hours. Plus, IJN uses 3D mammography or tomosynthesis, which produces more accurate results. And don't worry, the procedure is pain-free. You may feel some slight discomfort, but here's a tip. Schedule your mammogram after your menstrual cycle when your breasts are less tender. For women who are still hesitant about going for a mammogram, Sulaiman has this advice.
A small tumor or small cancer is not painful, cannot be felt. Okay, even though you have no family history, doesn't mean anything, because most of the statistics shows that majority of women with breast cancer has got no family history. And don't worry about radiation, okay, because your health is more important, and the radiation part of it is very little and very minimal and is very safe. Some people are worried about the outcome. Say, when I do this, I find something, don't know what to do, feel sad. I think it's better to know something early. Prognosis of the early detection is very good, okay? And don't wait until you feel alarmed, then only you see a doctor or to do other investigation.
Indeed, early detection can make all the difference. So take charge of your health and book a mammogram with IJN today. Natasha, Busst and Sheela, Vijayan, FMT.